My room is currently a mess, so just don't look at the back. But I wanted to show you guys something that I got. I really have an issue buying shoes because I think I've bought new shoes, 3 new pairs of shoes within the last 3 or 4 months, which is crazy because how could someone possibly go through all of these shoes? The thing is, I'm not. I just like to buy shoes. So I was on Dick's Sporting Goods the other day and I saw that these shoes were on sale, and they were just shoes that I've been looking at for a while. And so I thought that, you know, they were at a good price. I had a $10 off code and impulse buy just happened. So they're tennis shoes. These are the New Balance Coco Golf shoes. I think they're the CG2s. And I really liked the colorway of this one because this is the one that she wore when she played at the Roland Garros last year. And this is what they look like. I tried them on the other day. I really like how they fit. They're very comfortable. The only thing is, because they're designed to be high tops, they're kind of inspired by basketball shoes, so they come up a little bit higher than regular tennis shoes. I didn't know how to style them with my leggings just because I thought they looked a little funny, but that could just be because I think that high tops make me look a little shorter since I am on the shorter side. So I think I like the shoes. I like that the bottom soles are kind of translucent and then you can see everything that way. This is kind of like a suede material, and then this on the top. There's just a lot of design that went into this, and I really like the way that her shoes look. I think what I'm gonna do is I'm gonna end up throwing away my first Adidas tennis shoes. I think that's the best. Hey guys, so the segment of this video is going to be split up. So the last time I did it, I only got through a couple of questions and then I had to stop because I got a call. So today I'm gonna finish the rest of the questions and we'll see how many we get through. I think I was on question 6. I'm also eating this candy and it's so sticky. Literally can't get it out of my teeth. So question 7. A 2-month-old febrile male is brought to your facility to be evaluated for loss of appetite, irritability, and an acute petechial rash. Rectal temperature is 102.8. Which of the following studies is the most important in this child's evaluation? I think for a 2-month-old, what you're really concerned about is any sort of meningeal involvement with an infection. So particularly for this 2-year-old who's having a fever, I would say CSF analysis, and that is correct because you want to do an LP. The other things are important, like the CBC and the white count and differential, but they're already febrile. You know it's going to be elevated. A UA isn't really going to do much. Serum glucose, is more for looking at diabetes, and then a chest x-ray is helpful to see if there's pneumonia, but he has a petechial rash, so he probably has some sort of virus. And what's more important for neonates and like younger patients who are kids is you want to know if there's some sort of meningeal involvement, because that includes using IV antibiotics to treat. The next question. Your 27-year-old sister is visiting and requests you to refill dexamethasone and homatropin ophthalmic drops for her. What condition is most likely being treated? Oh, it's homoatropine. Homatropine? I think atropine is a like a pupil constrictor. So constricts your pupils. Blepharitis is like irritation of the eyelid. Conjunctivitis is possible. That's usually pink eye. But for that, you would give antibiotic drops. I don't think it's glaucoma because the drops she's asking for are constrictors. And usually for glaucoma, you want, if she has like acute angle glaucoma, you want to dilate the eyes. Or is hematropine like a dilator? I don't know what this is. The answer is iritis. Iritis is treated with steroids and miotic drops. So it's a constrictor of the pupil. 50-year-old male presents complaining of weakness in his grip. Your examination reveals the problem is bilateral. During the next office visit, you note the development of hyperactivities in his DTRs, extensor plantar reflexes, and dysarthria. The patient's sensory system remains normal and denies any urinary symptomatology. Which of the following is the most likely diagnosis? I will say that neuro was never my strong suit. The answer is ALS. And it says it's a progressive bilateral muscle disease which causes fasciculations and hyperreflexia, plantar reflexes, and dysarthria. Next. Which of the following is not a characteristic feature of multiple myeloma? I definitely know it's elevated serum calcium. There's punched out lesions. Osteoporosis is not always a characteristic feature. Plasma cell infiltration, familiar, and then hypoglobulinemia, question mark. I'm going to say osteoporosis, which is wrong. So is it hypogammaglobulinemia? It's hyper. What does this mean? Medical condition which elevated levels of gamma globulin. Hemonc is also not one of my strong suits. Okay, the camera died, but I'm back. So we're going to try to finish the rest of these questions before I have to go to my Orange Theory class. But which of the following is not a risk factor for the development of osteoporosis? Low testosterone levels in men. Also, the heat is on. You guys are sitting on the heat. So that's probably why you hear this bubbling sound. Try to ignore it. There's nothing I can really do. So testosterone is actually not the thing that is protective against osteoporosis. It's estrogen. So I'm going to say low levels of physical activity. What? Which of the following is not a risk factor? So low levels of activity is a risk factor. Oh, then is it low levels of testosterone? What? I'm so confused. What am I not understanding? Oh, cigarette smoking is protective? What? I'm actually confused. Low calcium diet, not protein, is a risk factor for osteoporosis. Why is this answer inadequate dietary protein? Wrong, guys. I'm just getting all the questions wrong. This is a little concerning. 12-year-old male presents complaining of no appetite for 24 hours and pain near his navel. During the night, the pain moved to the right lower abdomen. He's now nausea and vomiting, has a low-grade fever. In the operating room, normal appendix is discovered. What is most likely diagnosis? So cholecystitis is in the right upper quadrant. So this doesn't really have that same area. Mesenteric ischemia is possible, but usually it doesn't present with this type of pain. Let's say mesenteric adenitis. Yes. Can mimic appendicitis and usually occurs in kids. A patient that must be on a beta-blocking agent has reactive airway disease and commonly experiences central nervous system side effects from medication. Which of the following beta blockers would most likely be tolerated? Ugh, I forgot all of this. I'm gonna say atenolol. Nope. Propranolol. Nope. Metoprolol. This is a picky question for the boards. Of these beta blockers, which are usually avoided in reactive airway diseases, metoprolol is the most cardioselective, so theoretically could be used, although on an exam I would avoid beta blockers in general. If I remember correctly, there is a acronym that I learned for beta blockers, whether they're alpha or beta selective, and I think it was man-babe. Do with that what you will, but I'm going to move on to the next question. We're in a different room now. Let's continue with these questions. A polarized light microscopic study of joint fluid demonstrates negative bifringent crystals. What is the diagnosis? I think bifringent is rheumatologic. I want to say pseudo-gout, which is wrong. Oh my gosh. So is it gout? Oh, it's gout. So it says calcium pyrophosphate is prism-shaped crystals with positive bifringence, and gout is negative bifringence. Forgot all of this. I just realized that I cannot escape the sound of the heat because each room has its own thing. So I don't know if it's any lower in volume, but I hope so. I'm trying to walk you through my thinking process, but like generally there's no thinking going on. 44-year-old male presents with fever, cough, brownish sputum, rigors, and lethargy for 7 days. Chest X-ray reveals right middle lobe infiltrate and a right-sided pleural effusion. Thoracentesis is performed. Which of the following results from the pleural fluid analysis would be most characteristic of acute pneumonia? Is this Light's criteria? I think this is Light's criteria. All right, we're going to do pleural fluid to serum LDH ratio greater than 0.6. Okay, that makes me feel a little bit better because I'm not completely just, don't know anything. 56-year-old presents complaining of night sweats, weight loss, cough, and shortness of breath. UA demonstrates hematuria. Patient has a positive PPD 6 months ago, but was never treated. You order chest x-ray and expect to find pathology in which area of the lung? The apices. This is tuberculosis. Next question. Which of the following vaccines can prevent cancer? That's going to be hepatitis, because it can prevent liver cancer. A 51-year-old male who has smoked for 32 years presents complaining of a persistent cough. His chest x-ray is unremarkable. The cough begins shortly after he started a new medication. Which medication do you suspect? It might be a ACE inhibitor. Captopril. Correct. Which of the following is associated with the risk of reduced risk of ovarian cancer? Oral contraceptive use. Two more questions. We got this, guys. A patient is given a new product for an acute migraine headache. Shortly after the injection, the patient complains of significant chest tightness. Which of the following medications do you suspect this patient received? I don't know this one. I'm just gonna say sumatriptan, which is correct because it is a potent vasoconstrictor. Okay, so it got into their bloodstream, basically. Which of the following does not increase the likelihood of infection in a cancer patient? Thrombocytopenia is the platelet count. Let's say thrombocytopenia. Yeah. All right, so that was all. I ended up getting 79%, which is not terrible. I think, for someone who hasn't studied this stuff in such a long time, basically got like an 80. All right, I'm gonna head out to my gym class now. I will talk to you guys later, and hopefully this class doesn't kill me. All right, bye.